well tolerated, rarely hypoglycemia, but rarely caught angioedema and heart failure. And dose should be reduced to renal failure except linagliptin. GLP-2 inhibitors, dopagliptin, impagliptin, congliptin, they lower the cardiovascular events. This is a very good drug, but it cannot be given in renal failure. Yellow. তো উল্টা যাচ্ছে তো হ্যাঁ কয় করেছে হ্যাঁ Next important issue is the high blood pressure. I am quickly going because the time is. Next is hypertension. Hypertension is increasing in the busy life. Hypertension is the cause and effect of kidney disease affecting 50 to 75% individual. And 70% patients treated for hypertension do not achieve BP goal and at elevated risk of CKD and cardiovascular disease. In Bangladesh, type 2 diabetes in 1995 was 3.8%, hypertension was 11%. In 2001, it increased to 5.3% and hypertension 12.8%. And 2006 to 2010, diabetes increased to 9%, hypertension 15.3%. And 2018, hypertension is 20% and diabetes is 11%. But if you consider the treatment, 25% patients are treated and controlled, 40%, 44% treated but not controlled. And if you see that 31% did never know that they have high blood pressure. So you have to find out, screen and detect these 31% to start treatment. And these are the group of patients who develop chronic kidney disease and kidney failure, like diabetes. So risk factor, as you can see, obesity, smoking habit, and uncontrolled blood pressure. The blood pressure control, the medical student must know how to control blood pressure in sitting position, standing position, and lying position. I am sure many of the blood pressure checked is not real or true, even in doctors. Sorry for that. As you can see, the prehypertensive stage on hypertension, stage 2 hypertension. So we must give hypertension 140/90 according to JNC 8, no diabetes, no renal disease. If there is a diabetes and kidney disease, blood pressure should be further low to 130 millimeter of mercury by American Diabetic Association and JNC 8 as well. And if there is a kidney disease, blood pressure should be further low to less than 130 millimeter of mercury, again by the JNC and KDICO guideline. And if there is a proteinuria, they say that it should be further low, 120/80, but there is a little bit contribution recently, but blood pressure should be below 140/90. What drug should be prescribed? Thiazide diuretics, as for when there is no kidney disease, to be started. If blood pressure is not controlled, give angiotensin receptor blocker or AC inhibitor, second drug. And in third drug is calcium channel blocker. Fourth drugs, other antihypertensive, and the last drug is beta blocker. But if there is a cardiovascular disease, start with diuretics and beta blocker. Again, the hypertension in the elderly should be carefully noted, because once you are 70 years of age, your systolic blood pressure can be 150. You have to be cautious with women in pregnancy, hypertension. And you have to be cautious with hypertension in children as well. So you have to avoid the smoking, you have to modify your diet and modify your drugs as well. The lifestyle modification as suggested by 214 salt reduction should be 6 gram per day. Our salt intake is 10 gram in Bangladesh. Increase fruit and vegetable and fish oil intake and reducing cholesterol and saturated fatty acid. The target body mass index is less than 25 and reduce 4 kg management